So greetings from Orthobrain World Headquarters, high above the rock and roll capital of the world. Welcome Orthobrain dentists and new friends. I'm sure that you're really frustrated that the doors to your offices are closed, leaving your precious patients in need of care. You must have a lot of nervousness around finances, wondering whether we're going to be further delayed than other businesses to open because of the need to preserve masks and PPE. I know that you care deeply for the staff that serves your practice and all the anxiety that they must be experiencing. To be totally open with you, I feel very awkward at the moment. You're accustomed to very highly polished teaching materials of evidence-based proven processes. Although the content is lacking some of the evidence-based proven process that we typically have in our presentations, the authors who put this together for us did an amazing job, and I want to make sure that they know how much I appreciate the effort to build this for me. I don't believe that this really represents our business brand or our personal brand in terms of having the absolute top shelf presentation materials and practiced teaching. But then upon further reflection, I realized that that mission that I have internally and for our company is to make raving fans. And so this is a response to that need. Our expertise is in educating others to orthodontic certification in our 16-hour program. We're successful in webinar education thanks to abundant practice over the past few weeks. Hopefully we'll become expert in these webinar presentations. We are expert in virtual consultations, dentist to dentist consultations, because that's what we've been doing with many of you that are on this call. We're continuing to be a huge part of pioneering the advancement of the profession and the delivery of healthcare. Witness what's going on in the world with virtual reach out between doctors and patients, doctors and doctors, doctors and other healthcare providers, and doctors and public. The communications has really exploded, and really pleased that we've been able to contribute to that in our own way by launching this 4 years ago. This virus is a huge accelerator for medicine. The reality is that our patients need us now. Perfect has often been called the enemy of good. So right now, although we don't have a perfect presentation or a perfect system for you, we're doing our best, and you're not going to have a perfect way to interact with your patients right now, but I know that you're going to do your best, and that is far superior than retracting and ignoring and pretending like there isn't anything you can do. This effort from us is our very best effort to help you starting today. Let's respond to the crisis, and let's help our patients immediately, even if we're using some makeshift processes. The time that we have on our hands and the technology in front of us, it allows for abundant learning, for virtual appointments, social connection while we're having physical distancing. And these connections can be with our colleagues, with educators, with our patients, and with the broad community. On this particular webinar, as with some of our other events, we happen to have some very distinguished orthodontists that have joined us. A special call out to Dr. Eric Lawrence, an amazing educator who's been teaching orthodontic residents and general practice residents for decades. Dr. Wilson, also an educator of dentists and orthodontists. Dr. Zach Lawrence and Dr. Laura Lawrence, who made the Herculean effort to author the slides that you're about to see. So with that, I'm going to begin the presentation, and I'm going to switch to the slide deck. All right. Apologies in advance for any noise in the background. This is an example of how not to social distance or physical distance. This is right outside my window, and these guys are making such a racket, standing next to each other, jibber jabbering as if there's no virus or contagion to be worried about. So I apologize if you hear noises. Thank you for joining us. I hope you find this very meaningful and purposeful, and it's really the beginning of a new way to provide healthcare in our country, and you're going to be part of the pioneering process. Question: what will you do if you receive a call as soon as this presentation is over from one of your patients who says that they're in excruciating pain and they need to be seen? That answer might be obvious. What if the patient calls and has some vague symptoms and you're wondering whether or not there's anything that you ought to do? How are you going to respond? Are you going to meet them at the office and suit up the way you need to in order to protect yourself and protect your patients? Or should there be an interim step in order to determine whether or not an in-person meeting is needed? Furthermore, what is it that truly constitutes a dental emergency where care needs to be rendered, and in this day, at obvious considered risk? Old school meaning a few weeks ago or a month ago, you'd meet the patient at the office. If there was any doubt about whether or not there was something you could do for your patient, you would meet him at the office. So now you have the opportunity to meet them at a distance. So separating yet connecting the two of you can be a mobile device or a computer. Now that shouldn't be such a foreign procedure for all of the orthobrain dentists out there, because you really have been doing that in a sense where you do an exam on your patient and you collect records, and then you have that type of interaction through a computer, sending the records and a prescription, and it ends up in our lab. And so there's this virtual telemedicine that's occurring in the orthobrain world and has been since 2016. And then, of course, orthobrain sends everything back to you, and you're able to render care to your patient. So now the dynamic can still be performed in a similar manner, yet instead of going directly to orthobrain, you connect with your patient to collect the information, and you can process it. And if you're unable to process it, if you don't have the answer, then you're able to interact with us, or if we're unable to provide the answer, other colleagues, and maybe a periodontist or a surgeon or somebody else who'll be able to guide you on how to best care for your patient. So what you're doing is you're taking the model that you've become very accustomed to, a proven process of interacting through the computer and the virtual world and rendering excellent care to the level of a specialist. And now you're taking that same process in thinking and open-mindedness and applying it to the patients that you care for and who trust you to take good care of them. So the 5 objectives of the course are to go through the who, what, when, why, and how. So for the who, it could be any patient that resides in your practice, and you could actually go beyond patients that reside in your practice and make this service available to others in the community. The course today is going to focus on orthodontics because that is my narrow area of expertise. Many of the people that may reach out to you, if you make it known that you're able to perform this service, could become potential patients. So this service becomes a differentiator between you and other practitioners who are sleeping through the coronavirus crisis, whether you're trying to build your practice or build loyalty with your patients. So the who is whoever you decide you want to make this service available to. And what is it? It's virtual communication. It's real communication, but it's done through the internet. And so there are a variety of different platforms that you see listed along the bottom. Each one of these is a platform that you're able to use in order to communicate with others. Right now, we're on a platform called Zoom, which is wildly popular, and that allows the interactions. And it also has a feature that allows you to record, so that you can record the entire consultation with your patient and upload it into their chart as part of the medical legal record. I can't speak to the privacy issues that come up with some of these other platforms. Dental monitoring, of course, will be HIPAA compliant, designed for dentistry, and Dent2Go is a product that will be released in the United States soon that is really rather robust as well. It helps to have some lighting available, and the lighting doesn't have to be sourced from a fancy audiovisual company. It could be as simple as a patient having somebody else nearby that's holding a flashlight or a cell phone flashlight that's able to illuminate their teeth if it's too dark. So some of the virtual tools have been polished up in order to create an entire virtual practice. The purpose of what we're doing today is to help you deal with the issue at hand, which is, what do you do with your patients today? And this really becomes apropos now because of the extension of the stay-at-home order. So we know that we're highly unlikely to have our offices open until sometime in May, and it could be longer. So at this point, I believe it's important to reach out to patients. Other things that come in handy are lip stretchers. And if you're going to use the lip stretchers, Mira suggests that you place chapstick on your lips or Vaseline on that your patient uses that to make it a little more comfortable. Admittedly, I'm culturally illiterate, but I'm aware of this game that includes a set of those. Should your patients have one of those games, I would highly recommend that they be reluctant to place those in their mouth for fear of contamination and passing germs. But nevertheless, it is one way to source the lip stretchers. It helps to have your practice management software so you're able to access your patient chart. It'd be nice if your patient had gloves, the light, and if you have the perfect smile plan, if you're an orthobrain doctor, or your diagnosis and treatment plan, if you're a non-orthobrain doctor providing orthodontics. And then I'd like you to have the animation or the treatment setup ClinCheck, the aligner design animation available for you to review so that you know what teeth movements are coming up. So for those of you who are not orthobrain doctors, a little snippet, a little peek at what a perfect smile plan looks like in terms of the goals and the prognosis. It's nice to have this in front of you when you look at your patients so that you can speak intelligently as to what's coming up in terms of their treatment. This is the animation or the treatment setup that tells you how the teeth are moving and whether or not interproximal reduction is going to need to be performed before the patient advances to the next aligners. I suggest that you have consent, and typically we have consent in written form from our patients. In this urgent moment, if you should have a patient that needs to have a visit with you virtually and you don't have any way of getting a consent for treatment from them, then I would suggest that you document it in recorded form or in written form in the note that you say, you know, are you giving me permission to talk to you about your condition, particularly knowing that it's over the internet, and despite caution, your privacy really can't be guaranteed. I suppose there's some lunatic that wants to listen in on a teeth consultation. If you're planning in the future and you're forward thinking and you want to have all of your orthodontic patients scheduled in your practice for a virtual appointment, which is something I suggest, then you can in advance mail them a consent and mention the nature of this communication. So make treatment notes about anything and everything you do around the treatment, and make sure you put it into the treatment chart, including any imagery that you happen to make, because you're able to videotape or video record your conversation and what is appearing on your screen. And you're also able to do screenshots if you want to have kind of PDF, JPEG, PNG, whatever your camera does, and save those images and upload them to the chart so that you have a record. This product called DocuSign, and there are others out there, are a way for you to take a PDF, share it with a patient, and then they can digitally sign it to give you the consent needed to proceed with the consultation and or any care that you may render. So when do you do this? When should you initiate it? I'm telling you that we're already late to the game if we haven't started it. We're out of time, and in my opinion, this is my opinion only, that it's an intentional neglect at this point to ignore the patients and not make yourself available for them. So emphatic recommendation that you make this service available for your patients. So there's what I call intentional neglect. It's also a self-serving sort of endeavor, because by handling some of the appointments in the virtual world, you avoid having your schedule completely filled up at the opening day of your practice. So think about what your office is going to look like the first few days that you open. You're going to have a few patients that are going to have sharp elbows that are going to want to get in right away. The two of them are going to be people who are having pain and discomfort, but didn't want to be seen, or you didn't deem it urgent enough to see them. And you're also going to have it from a patient that is the most needy patient in the entire practice, and that is the patient who wants their braces off because their next visit was scheduled to get the braces off. And I know of one patient in particular named Ezra who is desperately trying to find a way to get his braces off. Patient safety. Patient safety is important, and I believe that patients are in much better condition if you have a look at them and use your video live streaming ability to make sure that there isn't anything going awry. And of course, everybody wants to progress in care. There's this tagline, it's not even a tagline, it's a guarantee that OrthoBrain has, and that is that you are never alone. And it'd be nice if your patients felt that they weren't alone when they're in greatest need. So how do you do it? Well, I guess back to my cultural illiteracy, I was told that the movie Space Jam is all about the NBA being closed down from a virus. And there's a way for them to deal with the virus, and there's a way that our virus is being managed, but everybody is going to get their mojo back. All these NBA players were unable to play basketball well as a result of the virus, and Michael Jordan, to the rescue, finds a way for everybody to operate again and play basketball, and this should allow you to be dentists again. Your practice software can come in quite handy, so if you're going to get real sophisticated about it, you can engage your team to arrange to have appointments and open up your appointment book for your virtual appointments, and do that from your home or your office with all of the distancing that's required. The other way you can do it if you don't have access from your home to your practice software is a product called Calendly. Calendly allows people to have access to your personal calendar or to your office calendar, and they click on a day that they want an appointment, and it shows them all the available times, and they take a spot, and it's self-populating so that you don't have to be a participant in making the appointments. If you need help with using a product like Calendly, then reach out to Steve at orthobrain.com for instructions. So how do you make your patients aware that you're able to offer this service? So you've got all the socials that are out there, and you can engage your patients. The other way that you're able to do it is to enlist your team to use this old-fashioned device called a phone, and to divide up the patient list and start calling patients to offer them the virtual appointments. And if they decline the virtual appointment, it's a great opportunity for your team members to let patients know that you are available. This is how they reach you. These are what to do in the case of an emergency, so that they don't feel that they're isolated alone and lacking access to you. One suggestion on the scripting is to speak with the patient and open with an acknowledgement that they must be upset or scared or frustrated that they don't have access to all their doctors, including you, and that you want to be part of the solution to have comfort and to remedy the fear that they might be feeling. You'll want to know if they have any urgent concerns and what it is that they need and what questions they would like answered during the appointment. There are different protocols for what to do depending on the orthodontic appliances that your patients have in place. So for the hygiene appointments, and I think that every patient should be deemed a hygiene patient. And when you're doing the hygiene assessment, if you're able to really get a good look at them, you'll be able to add some comfort to them and also add some prioritization as to when that patient needs to be seen for an in-office cleaning and exam. Because you probably have patients in your hygiene department that absolutely need to be seen every, say, 3 or 4 months because of their high risk of progressing periodontal disease, whereas you may have patients in their youth that have had a clean bill of dental health every time you've seen them, and that maybe their next hygiene appointment is not as urgent as other patients in need. In terms of aligner patients, and with all of them, you're going to have a good look. You want to know whether or not the aligners are tracking, and when we use the word tracking, we mean that the teeth completely fill the aligner. And then you'll look at your animation that I showed you earlier to be certain that they don't need any interproximal reduction. If they need interproximal reduction, you cannot go forward. And in that case, you can advise the patient, if they've already worn the aligner for the number of days or weeks that were prescribed, you could have them continue wearing the same aligner, but I would have them wear it nights only while they're in a holding pattern. And that way, you are less likely to have them relapse from a lack of wear or wear the aligner out from wearing it full time for a lengthy period of time. If they do happen to wear it out or lose it and there's IPR coming in front of them, then you may have them go back an aligner and hopefully they save the old aligner. And you'll evaluate to see whether or not you want to start elastics or discontinue bite correcting elastics. The cheek retractors are very helpful. If you are able to schedule these appointments in advance, you can either have your patient order them from a very reliable source, I'm assuming, Walmart, or you can provide them by leaving them outside the door of your office or your home. If it's urgent, then nobody's going to have time to go find and buy cheek retractors, and there's some alternate ways to retract cheeks than these conventional cheek retractors. These are some images of what it looks like if you go to the Walmart website. And for $10, you get 20 of these reusable dental lip openers, BPA free. Check to make sure that they can be sterilized before you order them. And let's get a look and see what an appointment actually looks like. So you're going to have a view that the doctor sees when looking at the patient through the computer, and at the same time, you're going to see the patient looking at the doctor.
Hey, Sean, how you doing today? Hey, Dr. Zach, doing well. Good, good. Family's doing well. Everyone's safe and healthy. It's a virus-free Wednesday, so good. So far, so good. That's awesome. Same over here. Good. Good.
Oh, hey, Dr. Gurman?
Right, and the good news is
yeah, would you mind just backing that video up a bit? It looked like when you muted your mic, it muted the video.
Healthy. It's a virus-free Wednesday, so good. So far, so good. That's awesome.
Presenting the chipmunks.
Good. All right, well, thank you for taking the time to schedule this virtual appointment with us today. I apologize that your in-person appointment had to get canceled, but as I'm sure you can understand, there's a lot that's out of our hands with this crazy situation. Yeah, I'm excited that you were able to keep going. Yeah, absolutely. All right, and the good news is that since you were able to take the time to do this virtual appointment with us, as long as, I'll be able to see whatever I need to see to assess if the aligners are tracking well or not. Okay. And if they're tracking well, then we can just continue as planned and not have to reschedule the canceled appointment. Good, sounds great. Yeah, I think you'd appreciate not having to come in another time. Yeah, absolutely. So what do you guys need? What do you need from me to make sure I look good? All right, so are you currently wearing the aligners? I am. Awesome. And what stage is this? I am in aligner number 21, and that is the last of the, you gave me 3 packs of aligners the last time I was in, and so I just transitioned over from number 20 to 21 yesterday. Okay, all right, so you have a couple more weeks then. Yeah, a couple more weeks with this aligner side, if I'm doing well. Well, is there anything that's been bothering you or any issues you've been having with the aligners? No, not at all. They were a little tight. In to do a scan. If teeth are just slightly off of where we want them and stay in the current aligner.
All right, check out these cheek retractors.
Any spoons available that we can use as retractors? I did, and I read the email when you asked me to do the appointment, and I don't know which spoons to use. I've got my regular soup spoon, and I've got like a bigger serving spoon. Which do you prefer? Let's try the bigger serving ones. I think that'll give us a better field of view. Okay, and then so yeah, actually you'll turn it the other way, so the spoons will face out. Okay, and then you'll put them inside the lips and outside the teeth on both sides. Okay. Yep, that's perfect, just like that. And now if you can get as close as you can to the camera. Yep, great. All right, so now, thank you for getting closer. What I'm doing now is I'm looking to see if there's any teeth that aren't tracking well. Because if teeth aren't tracking, then what we would want to do is we would want to stop and stay in the current aligner. That way, we can maintain the progress we've made until we can get you back in to do a scan. If teeth are just slightly off of where we want them to be, meaning you just see a little bit of plastic, like beyond the biting surface of each tooth, then we would just stay in the current aligner for an additional week. That way, we would give those teeth a chance to catch back up, and we can continue to progress forward. As I was just briefly looking there, it looks like all the teeth are tracking well. If you want to put the spoons in one more time so I can take a look, go side to side a little bit. Yeah, everything looks great. The good news is that since all the teeth seem to be tracking well, we can progress forward as planned. Great. Yeah. So what we'll do is I was just reviewing your chart, and I see we've already completed all the stripping in between the teeth that we needed to do. Yeah. So we can send you all the remaining aligners we have in your treatment, and that way you can just continue pushing forward with the same schedule you've been on. Great. Do I pick those up? Do you ship them to me? How does that change? That's up to you. Our 2 options are either we can mail them to you, or we can put them in a bag outside our front door at the office, and you can swing by and grab them. Either way will work fine. Just let us know what you would prefer. Awesome. All right. Well, I'll do that. And thank you. I don't know if I have any other questions right now. All right, Sean, that's great. Well, thanks again for taking the time to check in with us. Stay safe and have a great rest of your day. All right. Thanks, Dr. Zach. Absolutely.
That was great. Very well done. All right, so don't advance. If IPR is needed, if the aligners aren't tracking, and if elastics are needed, it's okay to advance the aligner, but you want to add the elastics. So in that case, you'll either mail the elastics to the patient or set them outside your door so that they can pick them up. But it's better if they put the elastics in when they're indicated. And for orthobrain doctors, we typically initiate the elastics when the bumps go on the teeth, the composite bumps called attachments or engagers. So chances are, if your patient has the attachments or engagers in place, then they could be wearing elastics. You'll do a visual assessment. You can use lip stretchers or the Terry method of spoons that she developed, and look at your patient so that you can assess the tracking or the fit of the teeth within the aligners. So let's start on your right-hand side with the first blue arrow. You can see that the lateral incisor is not fitting in the aligner. And in that patient, you have a few options. You can have them take the aligner out and visually look to see if the lateral is contacting the lower teeth. And if it is, then it can't possibly extrude anymore and fit the aligner. And you can see how the teeth look without it extruding, because the aesthetics may be fine. So at this point, you can make your own judgment, but this is something that you want to evaluate. There's a close-up of that same circumstance happening to another lateral incisor. And then on your left, you can see where the attachment on the bottom arrow is not fitting in the well. So there's the well the attachment's supposed to fit in. And in this case, the attachment is colored with a pencil. And in the office, I know I suggest using articulating paper or disposable markers, but somebody may have a new pencil. And if they do, and they want to color the attachments, that would be a way to do it. Maybe there are some other creative ways, but otherwise it's very difficult to see if an attachment is fitting in an aligner well. For your braces patients, you'll check to see if there are loose or broken braces, but you want to determine whether or not to stop elastics and sometimes start elastics. So let's take a look at what this is. So with the first patient, you had a grown man who was able to manage the spoons very, very well. And sometimes it can be challenging for the lip stretchers, especially in somebody who is not a full-grown man, but nevertheless a man.
Do you guys have the photo retractors that we sent you? The cheek retractors? Yep, okay. Those ones. Very good. So I've got a set here as well. When you look at these, the background's not helping. So one side, as you can see, is wider than the other side. So what we're going to do is, to start, we'll put the wider end in. So you'll grab the retractors near the narrow end. And then, Mrs. German, if you're going to do it for Ezra, it might help if you go behind him. Do you want to do it or should I do it? Yeah, so you want to go inside the lips, outside the teeth. Kind of funny, huh? All right, good. So now what I want you to do is open as wide as you can and look up at the ceiling for me. Now, can we bring the camera a little bit closer? Perfect. All right, good. So from this angle, what I'm looking at is to see the symmetry and the arch form of your top teeth. Now, can you look down? Open as wide as you can. Put your tongue back. Good. Awesome. Now I can see this arch symmetry and the arch form of your lower teeth. Very good. All right. So now what I'll have you do is look straight at the camera. Oh, we got some drool going on. So look straight at the camera and bite down for me. Good. Chin up just a bit. Awesome. Good. And now look to your left. And now take the retractor in your left hand and bring it back towards the middle. And then with your right, you'll pull back further. And remember, we want to turn to our left. I should have done this with my phone and not my computer. Okay, so we actually want to see the opposite side. We want to look down to the back teeth. So Ezra, if you turn your head away from the camera, good, and bite down. Awesome. Now can we turn to the other way? And bite. Can you see or do you need turn a little bit further, Ezra. The other way. There we go. Bite down. Good. All right, you can take the retractors out and relax. All right. So when we were looking from the side, I was able to see how the teeth are fitting together. And it seems like you're doing a really good job wearing your elastics, which is awesome. Good job. So because we've reached pretty much where we want to be with the forward back correction, you can switch to just wearing your elastics at nighttime only. That way we maintain the correction we've gotten, but we don't overdo it. And that'll keep us afloat until we can get to your next in-person appointment. Very good. Now, I didn't see any, but it was kind of hard to see. Do you have any broken brackets? I don't think so. No, we're looking good. Awesome. Yeah, that's great. Then everything's gonna keep moving the way we want it to.
Great job. So you're going to look at hygiene. Look at hygiene on all your patients and place a really strong emphasis on that. I'm going to get off that gross picture and then talk a little bit about what we just saw from the Dr. Zach and Ezra appointment. One point that can help the process, you saw that it was a struggle for Ezra to figure out how to hold the lip stretchers. They looked really big in his little mouth. And there was a little bit of silliness as he is a bit of an entertainer. But to be fair, I think it would help if the patient had a template like the OrthoBrain photo template to reference. So Dr. Zach or you as your treating doctor, if you can show the patient what the pictures are supposed to look like that they're making for you, you're going to be able to perhaps make it easier for them to be able to give you the right direction. And in fact, there are even apps be able to do pictures. So I know all of that's out there. I'm trying to solve the problem for you today so that you capture good pictures. It's not about capturing pictures. It's about the patient being live so that you can have them angle their head so that you can see best. But nevertheless, I think that the photo template will give patients a good idea of what you're trying to accomplish with the lip stretchers. The other take-home point from watching the video is that if you have a patient that's wearing nice clothes, in other words, if I were the patient and Dr. Zach was my dentist, I would hope that he would say, hey, on occasion, people will drool a little bit while the lip stretcher's in. Why don't you put a napkin in and cover up your fancy clothes? So lots of pointers like that. You're looking for loose or broken brackets, and if it's not painful, then you can have the patient slide the bracket right in front of the tooth, and it might be less unsightly and more comfortable for them to have that. Otherwise, you can instruct them on how to take the rubber band off. Elastics can be worn for bite correction while braces patients are there. You'll have to get the elastics to them, as we discussed for aligner patients. And I want to make sure that all the orthobrain doctors know not to start the rubber bands unless the patient is in wire 3, and that's why it's helpful to have the patient notes available when you're looking at the patient, and also the perfect smile plan to know whether or not the rubber bands are a consideration for your patient. For patients that are wearing the elastics, look at them with the elastics in and with the elastics out. If the patient doesn't have lip stretchers and they don't have spoons, I would not recommend knives. There may be some other utensils that can be used. I know turkey basters have been multi-purposed for years, but they can also use their fingers to help if that's more comfortable. Some people have really, really tight musculature, and it makes it hard for them to use the lip stretchers. So you're looking for AP correction. That's the backward, forward, the overbite, underbite correction, as well as the vertical. Patients currently wearing rubber bands that appear to have total correction, you can back off to nighttime wear only while they're waiting to come back in. If you don't, sometimes they'll rebound a little bit and be frustrated that they have to start the rubber bands again, thinking that they went backwards and lost time. Keep wearing the rubber bands full time if they still need bite correction. It's okay if they have slight overcorrection, because sometimes there is a little bit of rebound, as I just referenced. Additional elastics and other materials that the patient may need could be placed in a box, either mailed or left outside the door. For expander and appliance patients, similar process. I like the upside down head because sometimes you have to look upside down to see in there. My suggestion for expander patients, unless you are absolutely positive that they need additional turning, have them stop turning. So if somebody has one of those rapid maxillary expanders on the upper arch, I would stop turning because there are potential side effects that could occur that you wouldn't be able to necessarily see on a virtual appointment. So for the upper one with the key, I would stop turning until you can see the patient. For the lower appliance, you can visualize a lot better. So it would be okay, but if in doubt, just have them stop turning and wear it at night. You want to check for erupting teeth, and that's for the bottom appliance and for the top appliance. They're often placed in the mixed dentition, so you could have a new tooth come in and get stuck underneath the wire or underneath the plastic. Not only can a tooth come in underneath the plastic, but it could also have an unwanted force. So you can see the little piece of plastic here. As the jaw and the teeth are widened, it's going to push the tooth further out. And you don't want that. There's already a large diastema that's created. I would not expect a patient to take a Dremel and cut that off so it looks more like this. So at this point, I would have them stop turning. Look for overexpansion. This patient is perfectly corrected. In other words, it's ideal. But we prefer that they get overexpanded, so he's going to need an additional adjustment. So when you're making notes about what to do at the next appointment, you know to leave the appropriate time so that you can add additional expansion. The crossbite's corrected, to be sure, but yet we like to overcorrect it by about a half tooth on each side. You can also check for from the sides to see whether or not there's anything going on with the gums. Occasionally, as you expand a patient, You can have a little bit of gingival recession occur if the teeth are tipping too much or they're being overexpanded. So it's wise to check your expansion patients as carefully as possible. If in doubt, stop the turning. And in fact, you already know, I prefer that they not turn on top until they come back in. You have to tilt the head, of course, to see up there and have them occlude so that you can see in the back. So this patient is expanded to the ideal distance. Next visit, they need to be overexpanded. So set aside extra time for additional expansion. For your patients that are wearing bite corrector appliances, this is, I think of these as permanent rubber bands. They're spring-loaded rubber bands. And those patients can overcorrect. And if they do, it might warrant an in-person visit. This would be a little bit much for a patient to undo. There are some fixed functional appliances that are not that hard for a patient to undo. This happens to be one that is. For retainer patients, let's take a look at Dr. Zach.
Before we get started, do you have any issues or has anything been bothering you either with your teeth or with the retainers?
No, I don't really have any problems with the retainers. They're fitting good.
Good. And about how much would you say you've been wearing them?
I wear them every night, and then usually like maybe like 3 hours throughout the day. I do sometimes take them out and forget to put them back in.
Okay. But you don't feel like any of the teeth have shifted or anything?
No, the retainers still fit perfect. So
That's great to hear. All right. So do you have the cheek retractors that we sent you?
yeah.
Perfect. So as you look at them, you'll see a wider side and a narrower side.
Mm-hmm.
So we're going to start with the wide side. You'll put them inside the lips and outside the teeth on both sides. Yep. Just like this. All right. Very good. And what you'll do is angle them up and open as wide as you can and look up at the ceiling. Perfect. Can we get that camera a little bit closer? Good. All right. Now can you look down for me? Very good. All right. Thank you. Yeah, so looking at the biting surfaces of the teeth like that allows me to look for the arch symmetry, check to make sure if any teeth have shifted, and make sure that the arch form is all still good, which it appears to be.
Perfect.
Yeah. All right, so now we're going to take the retractors again, and we'll use the opposite side this time. So it'll be the narrow side, and you'll put them in and look straight at the camera and bite down. Yep. Perfect. All right. Very nice. And now look to your left for me. Like 90 degrees to your left. Yep. And now with the retractor in your right hand, pull back. Good job. Yep. And keep biting all the way. Very nice. All right. Now turn 180 degrees the other way and do the same thing. Bite down all the way. Good. All right. And we can, let's see. And very nice. Thank you. All right. You can take the retractors out and relax. How's that feel?
Feels good.
Yeah. It looks like it feels good. All right. So do you have your retainers with you?
Yeah.
Awesome. Can you pop those in for me? Cool. So now we'll take the retractors again. We'll go back to the wide side. And what you'll do is you'll look straight forward at the camera and close down about halfway, like this. Good. All right. Can we get that camera nice and close? All right. So looking this way, I can see how well the retainers are fitting by looking at the plastic and how it fits with the biting edges of your teeth. And I can see there's a couple teeth that we'd maybe like to see the retainers fitting a little bit better. The teeth may not have shifted that much on us yet, but we want to make sure that they don't end up shifting on us. So what we can do is, do you have any chewies? You can take the retractors out.
Chewies. There's pieces those I think that you. Oh no, I have no chewies.
Okay, so we can send you some, and if you use those for about 10 minutes each day, that'll help to get the retainers to always seat down again, and then that way the teeth will make sure that the retainers fit well and the teeth stay where they're at. Sound good?
Mm-hmm.
Awesome. Well, keep up the good work with stuff. Do you have any questions for me?
Nope, I'm all good.
All right.
Terrific. The patient was quite a bit easier to work on than the other child. So I think you had two great examples of working with children and a great example of working with an adult that didn't have any cheek retractors. Point of clarification, the chewies are little rubber, they're almost like cotton rolls, but they're made of rubber, and that they're often supplied to patients that are wearing aligners to help them bite the aligners into place. So they'll place the rubber cotton roll between the top and the bottom, and it'll just bite on those to help seat the aligners. And you can use those, brilliant by Dr. Zach, to repurpose those for a retainer patient to get the retainer to fit better. And also, I really like how Dr. Zach did a demo with the lip structures to really show the patient what to do. That was terrific. So I think the video really explained it well. For the bonded lingual retainers, you're going to be a little bit limited about what you can do. If one of the bonds is loose or it's a little bit scratchy, then have the patient wear the clear vacuum form retainer that fits over it as much as they need in order to keep them comfortable and also to prevent relapse if it's loose on a tooth. And for those of you who are not orthobrain doctors, you might not be aware, but we advocate for using the clear vacuum form retainers on top of patients' teeth, even if they have bonded lingual retainers for many reasons. So, very good. We had excellent learning in the video of how all this works. So you're looking to make sure that there hasn't been any unwanted change. And you could tell from the young lady that she probably is not wearing her retainers as much as she should, and she's having a little bit of relapse. Dr. Zach didn't call her out for it. I thought he managed it very, very well, encouraging her to wear the retainers more than she's been wearing them, and using the chewies to bite them into place. So compliance is a big issue, as you know, for retainers, but there's more to check than what we've shown you. So what happens if you know that you finished the patient well, but then you look and the front teeth are separating? So in this patient, they grew third molars, and it could be that the patients grow second molars that are not covered by the clear vacuum form retainers. So if you complete braces or aligners and you make vacuum form retainers, but they don't cover molars that are erupting after the fact, those molars can erupt, go into hyperocclusion, and open the bite, cause an anterior open bite. So you want to check to see where the clear aligner ends and whether or not there are any new incoming teeth. And that's what happened with this patient. If a patient lost the retainer and you practice in the digital world, well, then you're going to be able to replace the retainer by having a new one made using the original intraoral scan. Or if the patient had a printed digital model that they retained or you retained, then you're able to make the new retainer. You'll have to use your own decision-making process to decide whether or not you would want to make a new impression on a patient to replace a retainer during these times. That's a judgment call on your end. So this type of technology can be used for brand new patients. Think about how you could bring new patients into your practice, doing an initial consult, using the same strategy there. You can continue to grow your practice, and when we develop a presentation on exactly how to go through that process in a workflow, then of course all of you will be invited. Consider this the personal invitation. So we've gone through the 5s, and I guess the question that comes up is, what happens if you get information from your patient and it's around orthodontics and you're not sure what to do with that information? So if you're an orthobrain doctor, you log in right here at the login button. And if you're not an orthobrain doctor, you can go to that same login button and create a password and a username, and we will promptly review your application and approve you as quickly as able. And then you go to your new patient store, and at the new patient store, you're able to order a service from us if you need help. So if you're one of our doctors and your patient has an ultimate package, you already know how to interact with us, and it's included. There are no additional fees for you. If you're not an orthobrain doctor and you would like to engage us on patients that are already in treatment, then you can hire us to do a one-on-one consult with either one of our technicians who can help with some clinical how-tos, or with an orthobrain orthodontist. So the take-home message is communicate with your patients. There are a lot of different ways to communicate, and you'll find the way that's most appropriate for your patients, your practice. I can't say it's your obligation. It's an obligation to those whom I advise, because I feel so emphatically strong about your need to stay in touch with your patients, particularly with regard to comforting them, alleviating fear, and making sure that they're safe. The disclaimer to all this is that each one of you has your own state and country laws that you have to follow. This happens to be a notification that I'm sure all the Ohio dentists receive, and each state may be receiving similar communications. But here it's giving you kind of the place to hang your hat on using a telephone, audio or video, even through your personal equipment. So if you can have privacy and uphold all the privacy standards, getting a health grade Zoom account, of course do that. But you can see that there's some latitude under these provisional protocols. Consider these provisional, meaning that some of the processes need to be polished up when the crisis is over. And the bigger the drop in everything in our financial world and in our practices, the bigger the likely bounce is going to be. So be prepared for a whole lot of work to do when we're back and open again, and be smart about how you're going to manage your schedule. So the summary is, we learned how to communicate with our patients and with experts, whether it's orthobrain or some other specialty expert. And for the orthodontists that are on the call, you may come across some things when doing your virtual orthodontic appointments where you need to consult other specialists, or of course, I always advocate with going back to the primary care provider, the general dentist, and allowing them to quarterback the care that's outside of the orthodontics. So I admire all of you for taking the time, especially in Ohio. This is one of the more gorgeous days. Awfully nice to sit in the backyard and read a book or learn, but you decided to join us, and for that I'm really grateful to have the opportunity. I'm going to stop the screen share and continue speaking with you in just a minute. So I've got a few more comments for you, and as soon as I can get back live, so some concluding remarks, and that is that you've got this unique time. It's probably the only time in your career where your practice is going to be closed, and the door is closed, but the practice can still be open. Take advantage of the time and the technology that's in front of you to continue the learning like you've done today. I encourage you to master the art of the virtual appointment to keep your practice going, and to keep your patients feeling more comfortable and safe using the social connection. Differentiate yourself from other practitioners by showing your patients how much you care and how you're there for them, particularly in the most stressful times. That's a great opportunity for you to do so much with your team in terms of team building and educating your team and broadening the scope of the services that you provide. So the concluding remarks before I take questions is to stay smart by using your time very wisely, stay away from other folks, and most importantly, stay healthy. So with that, Veronica, perhaps you can help me appreciate if there are some questions to be answered.
Of course. So yeah, this is kind of the Q&A portion. If anyone has questions, please enter them in the chat log and we will give them right over to Dr. Gurman. And you can do that by hitting the chat icon at the bottom of your screen.
Okay. Very good. I'm seeing some questions about aligners. Seems like multiple people have questions about aligners. I'm going to try and read through a few of these questions about aligners and see if I can tie things together. All right. So what a lot of you are asking is, what can we do with this whole technology and process after our offices are open? And I think that's a great question. That's kind of an amalgamation of a handful of questions and turning it into one question. You can continue this mode of caring for patients beyond the crisis. So what's going to happen is when your office is open again, you're going to realize the incredible value of your chair time. And you want to make sure that the chair time is used to maximum efficiency. So when it comes to something like a retainer check or checking aligners to give the patient the green light to go on to additional aligners, or doing a check to see whether or not aligner elastics need to be continued for your aligner patients, I don't see a reason why you can't make some of your appointments virtual going forward. And it may be that you do that while you're getting caught up on all the backlog of patients that want to see you. My guess is that you're going to find it very appealing going forward, being able to take a lot of what we learn right now in crisis mode and apply that to our practices going forward to make us much more efficient in how we're using our physical facilities and our offices, and maximizing the production and the charges for the chair time. And I know for most of us, it's very difficult, me included, not to see the world from the patient perspective. We're thinking in terms of revenue, charges, production, and how we use our chairs, but also think of that in terms of what a patient perceives. So if you're an adult patient or a child, people are busy. They're very busy. And if they can have a virtual appointment instead of running over to your office and taking the time to drive there, park, sign in, wait their turn, get in the chair, visit with everybody. Some people, it's a great social event. And I know it seems like that in our orthodontic offices, and I'm sure it is in the general practice, where some people just want to hang out and be with you. But for a lot of people, they're busy and they want to get back to work or school and minimize the time out of the office. So I think it serves everybody well to make that available for patients if they so desire.
All
I
right.
hope that answered the question well.
We also have a question that says, I want to clarify, if I have a patient that is in aligners and engagers have not been placed, meaning they are at aligner 3, your recommendation would be to have the patient wear the current aligners at night only. Is that correct?
Yes. Yep. I'm going to read the question if I'm able here to see that. Patient and aligners, the aligners, they're at aligner 3, your recommendation. Correct. Okay, so it's a brilliant question. If your patient is supposed to have engagers or attachments and they have additional aligners to wear, I would have them stop at aligner 3 so they could wear aligner 3 if they have it. And then when your office opens, place the attachments for aligner 3 and have them wear aligner 3 for another few days or a week to make sure it's passive. Then they can go on to aligner 4. So I'll say it again, it's okay to wear the aligner that is supposed to have attachments, even if you're unable to place the attachments, but don't have them go to the next aligner without the attachments. When you do place the attachments, make sure that aligner 3 is passive and it's worn for at least a few days until it is passive before going to aligner 4. That was a really good question.
All right, and then we have another question that is, I have a child in an anterior bite plane to help correct deep bite. Are there risks or considerations to be addressed?
That's a great question. Yes, there are some big considerations. So do everything that we described for visualizing what's going on. A patient can overcorrect deep bite corrections. You could have somebody with overbite giganticus, deep bite giganticus. You place the anterior bite plane, the bite opens, but if the plastic's really thick, then they can go into an anterior open bite. So if that's going on, then you're better off taking the appliance out. I'd probably consider suiting up for that. If it's just a tiny bit open, not a big deal. But if they get a frank open bite, then you might want to consider removing the appliance. Highly unlikely, but I have seen it. The other thing is that they get stinky, and you can't do that from a virtual appointment. So you could have a parent do a sniff test, not stick their nose in there, of course, but the patient can kind of do it to themselves. Do they have a bad taste in their mouth? Does it smell bad? And if it does, then their hygiene needs to be improved upon, where a parent can help them with the swishing, put water in, swish it around, use mouthwash, make sure that the brush is getting up there to keep it clean, because they can get a little stinky underneath. Good question. So with that, we are over. This has been a terrific experience. If you have feedback for me, will you please email us, steve@orthobrain.com, to collect any suggestions on how we can do a better job with webinar presentations. This one in particular, but just our general format. It would be very, very helpful for us to get the feedback. As you know, we're very practiced at in-person presentations, and we want to be really good at this. We want to be best in business at this as well. So thanks in advance for your help, and everybody stay healthy and stay in touch.